see, how do I get me back on there? Okay. All right, let's try this again. Share my screen. Okay, there we go. Hello, I would like to welcome you to your breastfeeding class. Thank you for joining me. My name is Janice Nelson. I will be your instructor for today. Here is our objectives. We will be learning about breastfeeding anatomy, breastfeeding, the benefits of breastfeeding, breastfeeding myths, skin to skin and the rooming in, positioning and latching on, maintaining and making milk, common breastfeeding concerns, and the first few weeks of going home after leaving the hospital. In our first slide, we'll be talking about the breastfeeding anatomy. So as you can see, we have the nipple right here, which most people are familiar with. Then we have the milk ducts, which are these little lines right here. And they are the tube the milk travel through. So your milk travels through here into the nipple. And then there's little small milk ducts outside of your nipples where the milk actually come through. You have the alveolar cells, which are these grape-like cells, clusters here. This is the tissue that secretes the milk. And then you have the areola, which is the dark part around the nipple right here. So when you first look at the breast, the first thing we see is the nipple and we see the areola. But then the other side is the alveolus cells and the milk ducts, which are also a huge major factor in milk production. Here we have a video that goes into a little bit more detail about the breastfeeding anatomy. And let me try to get this video going for you. I am sorry, the video doesn't appear to be wanting to work. So in the video, it just went a little bit more detailed about the breastfeeding anatomy, how it works. I'm not sure if you have already noticed your areola part of your breast. You may notice some changes. The areola may have gotten bigger. It may have gotten darker. These are all different things and different changes your areola goes through. Your areola area is kind of like a bull's eye area for the baby. That's why it goes through different changes. It actually has a scent to it. The darkness of it helps the baby to locate it and to be able to latch on. The areola is also the part of the breast that we want the baby to latch on to. We don't want the baby to latch on just to the nipple. We want the baby actually to grab some of the areola parts also. Now, depending on how dark or how big your areola is, the baby is not going to take up this whole area of the areola. We're not looking for the baby to take over all of that, but we are looking for the baby to get most of the nipple and the areola in the baby's mouth, okay? So let's talk about breastfeeding hormones. There are many hormones that relates to breastfeeding, but the ones that we like to focus on the most are prolactin and oxytocin. So what is prolactin? Prolactin, we also know called the milk-making hormone. So it's actually the hormone that creates the milk. Oxytocin is what we like to call the feel-good hormone. So the oxytocin hormone is the one that helps release the milk, but it also helps mom to relax and help baby to relax, and also help mom and baby to connect and bond with one another. So once again, prolactin. Prolactin is the milk making hormone, and the oxytocin is the milk releasing hormone. Now, prolactin plays a huge part in sustaining our milk supply. So part of making sure that we have enough milk is allowing the breast to be stimulated, which will get the prolactin hormone working, which will help continue to create the milk. So if you look in this picture, we have the mom here, and she's holding the baby to her breast or to her chest, basically embracing her baby, gazing into the baby's eyes, things of that nature, bonding with her baby. So this right here gets the oxytocin going, the feel-good hormone going, things of that nature. Then we have the oxytocin and the prolactin being triggered, because now you have latched the baby on. But as you can see, the baby's touching the breast, that helps stimulate oxytocin, which helps stimulates the milk to release. That helps bonding between mom and baby. Mom is holding baby close to her, so that got those two hormones, they're going again. The oxytocin, the prolactin is going. So then we go to the aggressive decrease, the intimacy. So this is more just, laying back, mom relaxing, babies relaxed, just nourishment, things of that nature. Mom brain is being triggered, mom brain is being taught on how much milk she should make for her baby. That's all about breastfeeding also. So with the baby being latched onto the breast, it helps train the mom's brain to know how much breast milk she should make. So the stimulation of baby's mouth onto the nipple and the areola encourage the oxytocin and the prolactin to do its job. It promotes it to make milk, which is the prolactin, and to release milk, which is the oxytocin. Then we call it the feel-good feeling, which is the oxytocin being released. Mom is relaxed, baby is relaxed, and everyone is happy and ready to go, and patiently waiting to start the cycle again. We also like to point out colostrum. Colostrum is something we call liquid gold. Colostrum is the first form of milk that the mom will receive. Now, you may have heard of mom doesn't get her milk till later on, or things of that nature. So it's not necessarily that the mom doesn't get her milk till later on. It's just the milk changes. So the first few days after birth, mom will receive colostrum, which is this real thick, yellowish type of milk. It's very potent with a lot of nutrition and vitamins and antibiotics that the baby needs, but it also comes in a very small, tiny amount. So it's very impactful in what it does, but it comes in a very small amount. And the next slide will kind of give you an idea of why the amount that the baby receives at the beginning, the colostrum, is in such a small amount. So let's go on to that. Well, I'm sorry, let's talk a little bit about the benefits of colostrum. So, as we talked about, it's a superfood, pre-milk liquid. So you have some people who may not refer to it as breast milk, but it's milk. It's just thicker, if you think about the different kind of milks we drink as human beings, you get whole milk versus soy milk. versus rice milk versus almond milk. You know, all of them have their own different texture. So it's kind of the same thing when babies, mom's milk goes from colostrum to what we call mature milk. So it's all milk, it's just different stages and different texture at different points of times in baby's life. So it is a superfood. Once again, I said it's full of antibiotics, it's full of vitamins and nutrition that the baby needs. You produce it right after birth. Some moms may experience before she gives birth, she may experience some release of colostrum. It normally happens a lot in moms who have had multiple children, but first-time moms can experience leakage of breast milk before she actually gives birth. So it's not uncommon. As I said, lots of benefits. So this is what I was talking about. Now, this is at 3 days. Okay, these are just examples, you know, of what they classify is the average. Okay, for each mom, it would be different. No mom is the same. So this is what they classify as average. So look at 3 days. 3 days is 1 milliliter, not even 2 milliliters. Okay, then 5 days, a mom may have more milk come out. Also, you start seeing the changes. You know, it's really yellow here. Here it's still kind of yellowish, but it's not as yellow. Then you look here, it's getting a little bit lighter. But if you look here also, you can start seeing the separation, you know, of the milk also. And then here. So this is gradually going from colostrum into what we call transition or mature milk. And as you see here, 6 days, this bottle technically has more than 25 days. As I said, the amount in the bottles is not something I really want you to focus on. What I really want to point out in this video is how the first milk, which is called colostrum, is darker yellow and it's thicker. And it comes in smaller quantities. And as the milk matures and transition into mature milk, it looks more like what we're used to milk looking like, this whitish kind of color. Okay, so that's what I want you to focus on, not the amounts in the bottle, you know, not what they pumped in 6 days, you know, because I said that can vary per mom, per a lot of different things. I just really want you to see the different stages that colostrum goes to until the transition to mature milk. This is something else I wanted to point out. How big the newborn stomach is. Look at this. You see how big the baby's stomach is at 1 day. Imagine a cherry. It's very small. So we're not looking to get not even all of this. We don't even want to get all of this into that. That's too much. So you may hear a lot of people say, you know, they're not making enough or enough not coming out, you know, especially in those beginning stages of colostrum, you know, that they may only get a teaspoon or whatever the case may be. But look what it says, 1 to 1.4 teaspoon is what a 1-day-old baby needs. Look at what a 2-day-old baby needs. Not that much further, not much more. 2 days, walnut, still very small. 1 week, an apricot, that's the size of the baby's belly. Then 1 month, an egg, that's the size of a baby's belly. Now, of course, these measurements can change. They can vary from baby, you know, from feeding, things of that nature. So this is something else I don't necessarily want you to put all your focus on. This is the visual that I really want to leave you with. I wanted you to see how really small your baby's stomach is and how it doesn't take a lot for your newborn baby tummy to get full, and how your breast milk is the right amount and the right temperature for your newborn baby. Okay, So these are the things I want you to leave with. How small it is and how it takes a while just to even get to the size of an egg. And that's for the baby is 1 month old. So let's talk about some of the benefits. Benefits for baby. It lowers the risk of ear infections, diarrhea, pneumonia, diabetes, sudden infant death syndrome, obesity, childhood cancer, and heart disease, okay? So these are some of the things it lowered the risk of. It is the first baby antibiotics, which we spoke of about earlier. It also is always the right temperature, and it's easier for the baby to digest. But one of my favorite things is that breast milk is a living organism. So what does that mean? What does it mean for breast milk to be a living organism? That means your milk that you make for your baby changes to meet the needs of your baby. So your breast milk knows that your baby needs different things at different growth stages and developmental stages of their life. And your milk begins to customize what your baby needs for its nutrition. I think that's pretty good. It's pretty awesome. I don't know too many things that I eat that does that. So that's something that our breast milk does. It customizes itself to make sure that our baby has what he or she needs to be strong and healthy like they need to be. Now, we're always talking about the benefits for the baby. Let's talk about some of the benefits for mom. It actually helps lower high blood pressure, ovarian cancer, breast cancer, type 2 diabetes, okay? It also increases the chances for a mom to actually lose her birth weight, and it increases bonding between mom and baby. It lowers postpartum depression, and one of my favorites, it is free. As we like to say, free 99. Breast milk is free. Breastfeeding is free. So that's another major benefit that breast milk has for the mom and the family. It saves money on the household. Now let's go over some breastfeeding myths. Have you heard of any of these myths? Breastfeeding hurts. My breast's gonna sag. I have to change my diet. Breastfeeding is a form of birth control, or I will have to stop taking my medications. Well, why are these myths? If breastfeeding is hurting, that means there is something not right. And we want to know why breastfeeding is hurting. So if you are experiencing any pain during breastfeeding, then you need to contact someone so we can get to the bottom line of why you're experiencing pain, because that is not what you're supposed to experience. So I want to say this again. We do not want you to sit through being in pain in the goal of trying to feed your baby. If you are experiencing pain while breastfeeding, please contact someone so we can evaluate why you are experiencing pain and we can eliminate further pain in the future. My breasts are going to sag. Well, breastfeeding does not cause sagging breasts. Life and time does. That's called getting old. It's called aging. Breasts gonna sag unless you do some medical, something medical to keep them from sagging. Your breast is gonna sag whether you breastfeed or don't breastfeed. It's just part of getting older. It's just gonna happen. It's part of science. It's part of gravity. It's just going to happen. So breastfeeding is not going to cause you to have sagging breasts. I had to have a healthy diet, or I have to have a specific diet, or I can't eat certain foods, or I have to stop eating hot sauce, or I can't eat my hot peppers anymore, or I can't eat those collard greens, or all the other things that you love to eat. Unless you have discovered that there's some complication with your baby, maybe getting gassy or showing some levels of being allergic to something, you do not have to stick to a particular diet in order to breastfeed, in order to have a successful breastfeeding experience. Now, we do encourage you, just like we encourage you in pregnancy, you know, stay hydrated, drink lots of water, eat a balanced meal, you know, try to get as many fruits and vegetables in your meal. Try not to eat as much junk, you know. The same thing that we're expecting you to do in your pregnancy is the same way that we're expecting you to eat, you know, in your breastfeeding. And to be honest, you have more freedoms in your choices in what you can eat in your breastfeeding than you do in pregnancy, because there are certain things that they try to get pregnant mom to eliminate while they're pregnant. Things like fish and seafood, they try to limit it, you know, to that in pregnancy, but in breastfeeding, you can eat fish, you can, there's nothing you can't eat. There's nothing that you cannot eat. There's no special diet. You don't have to become a vegetarian. You don't have to become a super health fanatic all of a sudden because you're breastfeeding. We want you to stay nourished because it's important for you and it's important for your baby. We want you to stay hydrated because it's important for you and it's important for your baby. So no, you don't have to stop eating your hot sauce. No, you don't have to stop eating your collard greens. No, you don't have to stop eating whatever else you're enjoying to eat. We're just asking for you to have a balanced meal. You know, try to get as many fruits and vegetables as you possibly can. You know, enjoy your pleasure food, but maybe do it a little less, you know, and it's just for health reason overall. It's not necessarily for any particular reason doing for breastfeeding. It's just you want to be healthy for you and you want to be healthy for your baby. That's pretty much it about the diet. As I said, if you started seeing that your baby maybe be gassy a lot, and let's just say it's around the holidays, and for the last 3 to 4 days, you've been eating greens, beans, black-eyed peas, anything that normally makes us gassy, you know, and you're noticing, you know, so I would say, you know, start observing, you know, if you're backing back from those things that considered to cause us a lot of gas, then you start observing the baby to see if that helps, things of that nature, because what we do eat, a portion of that does combine with our breast milk. But, you know, usually it's in such a small amount that it shouldn't cause too much alarm or concern. But as I said, if you start seeing anything or anything you're concerned about, stuff like that, and feel free always to contact a lactation consultant, you know, just for verification. If you're noticing anything or if you have any concerns about something that you're eating that you feel like may be having a negative effect on your baby. But no, we don't have a breastfeeding diet that you have to follow. Birth control. Breastfeeding is not a means for birth control. Why do people feel that way? Well, people feel that way because some women do experience delayed cycles while they're breastfeeding, especially those who are exclusively breastfeeding. What does exclusively breastfeeding mean? Exclusively breastfeeding means that you are feeding your baby breast milk directly from the breast, from you exclusively, meaning the baby is not getting any bottles or anything of that nature. Breast milk is strictly coming from mom, from the breast, and sometimes that causes women's cycle to be delayed. That does not prevent women from getting pregnant. You can get pregnant while breastfeeding. So because women's cycles sometimes get delayed, or not, I don't want to say delayed, but their cycle don't come in right away. And as I said, it's case by case. Some women cycle come in right away, even with breastfeeding, no pauses, anything of that nature. Some may go 3 to 6 months, without having a cycle. And it varies from woman to woman, but you cannot use breastfeeding as a means of birth control because you still have a high chance of getting pregnant while breastfeeding. Medication. Many medications you can still take while breastfeeding. Now, of course, when it comes down to medications, we do want you to speak to a lactation consultant just to confirm with them what is okay, what's not okay. There's very limited amount of medications that you cannot take while breastfeeding, but there are some that are out there. And just to be on the safe side, not having any complications, or to make sure that none of your medicine is going to mess with your milk supply, just speak to a lactation consultant. But majority of the medicines that are on the market, whether behind the counter or not behind the counter, are okay to take while breastfeeding. But if you have any questions, any concerns, anything of that nature, please reach out, and ask. There's no question too crazy, too dumb, too silly, too small. We want to make sure that you and your baby are okay. So reach out, ask your questions, things of that nature. Facts about breastfeeding. There are no such thing as too small or too large of a breast to breastfeed. Size does not matter. Breast size does not matter. A woman who has big breasts does not mean that she's going to have an oversupply of milk. A woman who has small breasts does not mean that she's going to have a low supply of milk. It does not matter at all what your breast size is. That would determine whether you can have a successful breastfeeding experience or not. Nipple size doesn't matter either. It's the same thing. You may have heard of inverted nipples or flat nipples, things of that nature. There are many successful cases of women who have inverted nipples or flat nipples who have successfully breastfed. Inverted nipples are not as common as we have perceived them to be, but there are some women who actually have inverted nipples. But there are different methods that we can try, different things that we can do to make sure a mom has a very successful breastfeeding experience. So breast size doesn't matter, nipple size doesn't matter. If you want to breastfeed, we're here to help and guide you, and we will work with you to accomplish whatever breastfeeding goals that you have. Breastfeeding is a new skill. I want to say that again. Breastfeeding is a new skill. So it's new for mom and it's new for baby. So therefore, the biggest key in breastfeeding is patience, because mom and baby are both learning how to do this. Breastfeeding is natural. Our breast, when we get pregnant, develops milk, and it was created to nourish our babies. So in that aspect, it's normal, it's natural, and you would think it would just be easy to do. But if we compare birth to breastfeeding, giving birth is normal, it's a natural, it's something that our bodies were created to do, but it's also a process, and it's also something we have to have patience for, and it's also something that takes time, and it's also something that we need help and support with. So just like we need help and support with giving birth, we need help and support with nurturing our children with our breast and breastfeeding. So patience is key. Be patient with yourself, be patient with your baby. And eventually, with hopefully help and support of us and other support people around you, you will be able to successfully achieve your breastfeeding goal. Babies do not need water to breastfeed. Breast milk is 80% water. So we do not need to give our babies additional water because we believe that they're going to be dehydrated. Babies will not be dehydrated. They will be perfectly fine with the amount of water / nourishment and everything else in your breast milk. So that is something that you do not have to worry about or concern about your baby getting dehydrated. Next slide, benefits of skin to skin. So as you can see in our lovely pictures, we have right here, we have a father and his older son, and both of them are holding the new additions to the family, and they're doing skin to skin. And you have another mom who is being monitored by a nursing staff and her skin to skin process. And then you have another mother who's doing another form of skin to skin. As you can see, most of them have the babies above their chest like this and then covered. And then this mom has her shirt up here and the baby is more on her stomach, area, lower area. The main thing about skin to skin is that we want baby skin to your skin. Now, as you see, Dad, she put his shirt over his head because he wants his bare chest to touch baby's bare bottom. Mom's bare chest touching naked baby. Same down here. Mom skin touching baby's naked skin. So that is what we mean by skin to skin. So we don't want any cloth covering barriers between mom and baby. We want baby skin touching complete mom skin. Same with big brother and little baby. Skin to skin. Nobody has clothes or blankets or towels or anything of that nature separating them. And the reason we want this is because it calms and relaxes both mom and baby. It regulates baby heart rate, breathing, and temperature. It stimulates digestion in baby. It encourages the baby to self-latch onto the breast, and it stimulates hormone in the mom to start bonding again with her baby and releasing her mothering instincts. So this is what skin to skin looks like. And as you see, everyone is pretty calm. This baby looked like he might have been fussing before he got onto mom, and now he or she is calming down. But yes, it brings a level of, for fathers, it allows the father's bonding instincts to kick in with their newborn babies. So it's important for fathers to do skin to skin, especially if mom is not able to, because maybe mom had a C-section, or maybe there was some medical reason why mom had to be separated from the baby. Then if dad or the partner or another support person who's in the labor delivery room with mom is able to do skin to skin, that's great. Skin to skin is good for baby and her adult caretaker if mom is not available. The golden hour. So there are 9 different stages in the golden hour. And the skin to skin part plays a big role in the golden hour. As we talked about, it creates bonding. So one of the most important things about the golden hour is that it creates bonding with mom and baby. And it also encourages the baby possibly to actually self-latch. Self-latch is actually when the baby crawls up to the breast and latches on his or herself and start nursing. Excuse me. So in its different stages, it kind of talks through what that first hour is. So we call it the golden hour because in that hour, you're doing skin to skin. And in that hour, you're allowing these different stages to happen for the baby to get familiar with his area and the senses of his hands and things of that nature, for mom to bond with the baby and stuff, and kind of let the baby go through these little stages. Now, every stage may not go exactly how it says. As if you want more information, there's a website right here about the 9 actual stages that they say a baby goes through in the first hour. And there are actually videos on YouTube that are pretty amazing, where you see the baby actually minutes, within birth, eventually within that first hour, crawling up to the breast and latching on. It's a pretty cool thing to watch. But I didn't want to go over all stages here with you. I just wanted to point them out that, the golden hour is very important. and things that happen in that hour is skin to skin, possibly self-latching on with the baby, and bonding with mom and baby. Rooming in is also part of that golden hour because the baby stays with mom. That's another thing about the skin to skin. And the rooming in is baby and mom is always together unless there's some medical reason that they have to be separated. So a lot of the newborn exams that they have to do, they can do while the baby's on mom. Some of the I think the heel stick that they do, the medicine they put in the baby's eyes, just different things that they do to make sure the baby's okay. They can do it on mom as long as mom is okay and as long as baby's okay. There's no medical emergencies or issues, anything of that nature. A lot of the stuff can be done while mom and baby still skin to skin with each other. And the benefits of rooming in is that one, again, that bonding is very important in those first few hours, in those first few days. So rooming in encourages bonding. It encourages breastfeeding. It allows the mom to learn feeding cues, and it both gives mom and baby the opportunity to rest. I know it's like, how do you rest with a newborn baby? It's just the peace of mind knowing that your baby is there, knowing your baby is safe, knowing that you can see your baby and hear your baby and know that your baby is okay. That helps mom to relax and rest and things of that nature. And then baby's connected to what he or she known for 9 months. So, it's the sense of mom, the smell of mom voice, all of those things help soothe the baby. So that's another benefit of actually rooming in with mom and baby. So let's talk about feeding cues. Let's go back to that. So feeding cues are different things that newborn babies do. Well, I'm not gonna say newborn, but what babies do that indicates to us that they're hungry. So some of the things that they may do is they may see them sucking on their tongue or trying to suck on their fists or their fingers. Some babies may do rooting for the breast. So basically they're just, especially if you're holding a baby, you may see the baby turn their head, and try to root for the breast, or if the baby's laying on your chest and the baby's mouth is on your skin, the baby may start sucking on your skin or anything of that nature. Those are usually signs that the baby is hungry. If the baby is sleeping already, but you start seeing the baby eyes move back and forth real fast, things of that nature, that's a good sign that eventually the baby is going to wake up and want to feed. If the baby start making a lot of more noises. Now babies make a lot of noises, especially newborn babies. But sometimes, the wrapping of the eyes and the moving of the noise making are usually all kind of indication that the baby be waking up soon to eat. But if the baby's already woke and you see them sucking on their tongue, sucking on their hands, sucking on their fingers, sucking on you, anything of that nature, then they're hungry. What we want to try to do is we want to try to identify the baby's feeding cues so that we can start nursing the baby before the baby start crying. Because once the baby when the baby gets to the point of crying, that means the baby is frustrated. And that means we done missed all the feeding cues, and now they only resorted to what they know to do next to try to get our attention, to let them know that they are hungry. So we're trying to identify the feeding cues before we actually get to the point where the baby is crying, especially the newborn babies, because usually when they get to that point, unless you have a child who just has no issues latching on whatsoever, as soon as you put the baby to the breast, they're going to latch on, then that's fine. But then you have some babies, especially when you're in the learning process, mom and baby, when they get that frustrated, it's harder to get them to cooperate with you to latch on. So if you start learning the feeding cues and start preparing yourself to feed them and not wait you don't even have to wait till they're fully, just start getting them maybe change change their diaper to try to wake them up further, and position yourself to nurse them so that the baby may be more cooperative to work with you, especially if you're having a little bit more complication with latching the baby on. Breastfeeding positions. So we have the cradle position. We have the cross cradle position, we have the football hold, lay back position, and the side position, okay? So the cradle position, as you can see, the mom is supporting baby like this. Baby's here, mom has this hand pretty much free. She can use this hand to maneuver the breast, to use that hand to actually latch the baby onto the breast. Cross cradle is the opposite. So you have using this hand to support the baby, and then this hand to support your breast and try to get the baby to latch onto the breast. Football hold is more of the baby is actually, the baby is actually here. So the baby's head is here in your hand, and then the baby body is in like the armpit of your arm, and then you're putting the football, and you're using your hands and stuff to latch the baby on. The lay back, the lay back is just pretty much self-explanatory. You're laying back, either propped up in the bed, maybe you have a reclining chair, and you're nursing, and then a side laying is basically you're laying on your side, baby's on his or her side, and you're nursing. Another thing about the positioning is that, as you can see, baby is turned towards mom. On this one, it's kind of hard to tell, but baby is turned towards mom. So we want baby's belly to be turned towards mom. We want baby's head, shoulders, and hips to be lined up, and as we said, baby's facing into mom. So these are the different positions that we have with the newborns. And I keep saying newborns because once they get older, they get a little bit more, they start moving a little bit more and start creating their own positions to breastfeed. But these are the first stages. When you're a newborn, different positions that you can try. Some position works better than others. Some position works better with one side than the other, meaning that one position may work better for than the other one. So all of those things are common. Some babies like one position better than the other one. You might like one position better than the other one. So these are just different things you kind of play around with. You can use pillows to kind of help you support, towels, roll up towels, different that nature. The main thing also, we want to make sure that you're comfortable while you're breastfeeding, for you to try to be as comfortable as you want. It's also good to maybe have some water or something to drink to keep you hydrated. You might even want a little snack. While you're nursing, you might want to have something for you to snack on to keep your nourishment going also. So those are just different things that you can include in your breastfeeding. So the latching on. So in this picture right here, so you see how wide the baby mouth is. Now, this may be a little bit more dramatic in what you may actually see with your baby's mouth, because things changes with each baby, but we want a wide opening. So what we really want to do is, as we go to this picture, we want for you to put the nipple right in between the baby's mouth right here, right above the lip. Put your breast right above the lip, okay? And what this is going to do, if the baby cooperates right, is it's going to make the baby open their mouth. And when they open their mouth, okay, we're going to have point your nipple here, but we also want to have your nipple pointed up. So when they open their mouth, we can bring baby to breast, and get the mouth onto the breast, okay? And once again, we don't want baby here, we want baby here, okay? We want him or her to get as much of the areola as possible. So you can see, the nipple is pointed up, so mouth is open, so they're going to slide the nipple into the mouth, just like this. So once we go down here, nipples in the mouth, you see, you got nipple and you have areola, nipple and areola. You see the baby's not latched onto the nipple, the baby has the areola. And you see how far back it goes in here, and it's just some more visualizations of where we want the nipple. We want the nipple in the far back part of the baby's mouth and not right here, because that's going to cause you major pain. So we go through this. It says, hold your breast with one hand, support baby with another, bring baby close enough so that you can find your areola without effect, okay? So once again, we want baby turned towards you. We want neck, shoulder, and hips lined up with one another. We want to bring baby to breast and not breast to baby, okay? Then you stimulate the baby's upper lip, once again, right here with the nipple, until the mouth opens very wide. So we want the nipple, we want it pointed up, baby open up the mouth and go in. So your baby chin should be the first thing that makes contact with your breast. That allows a deeper latch. Then baby's lip must be completely turned out. So we want the upper lip turned out and we want the bottom lip turned out. We don't want your baby like this on your breast. See? See how my lips are folded? We don't want that. We want this lip out and we want this lip out. Okay, make sure the baby nostrils are clear and the baby is able to breathe easily. So these are just different steps. Again, it's going to be trial and error and trial. We have some babies who latch on with no complications, issues at all. We have some who needs a little bit more help. So it varies. So this is the part where I said patience. This is the part where I said patience for you, patience for the baby, because you both are learning how to do this. So this one, I just like it because I feel like it really gives us an example of how our breasts look in the baby's mouth. I know this can appear to look painful, but if actually this part, which we would say is the nipple, were actually here, that will be painful. This right here will feel better than this being part of that part. So you have the baby tongue, you see the baby lip out here and the baby's lip out here. So this is what we want the baby's lip to look like. Sometimes on this angle, we may need our partner or our husband or a support person just to kind of double check the bottom lip to make sure that it actually is flared outwards and not flared inwards, because that will cause issues for mom. Once again, you see that we have a lot of the areola into the mouth. And we wanted to get it to the back part of your mouth. So if you will actually take your tongue and put it to the roof of your mouth and go right here, like to the front part of your mouth, and then go to the back part, you will feel two different textures. Well, that second part is where we want actually your nipple to be, because that palate right there won't be as rough on your breast. So as much as this look like it's strange and a little awkward because it seems so far back, this is actually a normal breastfeeding demonstration, okay? So we got the milk ducts again, the areola right here again, and then the baby's tongue right here. Maintaining your milk. So once again, when we talked about earlier about the milk producing hormone, which is prolactin, one of the things is breast stimulation. Breast stimulation. I know that's the bottom. I should have had that as the top because breast stimulation. Skin to skin, encourage breast stimulation. Rooming in, encourage breast stimulation. frequent removal of milk from the breast, basically either by baby, meaning the baby is latched on, by hand expression, or by pumping, are ways to remove milk from the breast, but also those are all things that does what? Breast stimulation. Correct latch is also a great way to maintain your milk, which also helps to breast stimulate. So all of these things help breast stimulation, and breast stimulation is key to continuing your maintaining of your milk. So signs that baby are getting enough. We have the deep latch, as we demonstrated earlier, making sure that the baby is latched on correctly. And you are comfortable with the feeding, making sure that you're not in pain. So that's a good sign, you know, especially if you were experiencing pain and no longer experiencing pain while latching on, those are good signs. The baby is steady sucking, so we have suck, suck, swallow, suck, suck, swallow. Hearing the swallowing, hearing the baby's actually swallowing are good signs that the baby's getting milk. Your breasts are soft after the feeding. Once your mature milk come in, sometimes when you're transitioning from colostrum to your mature milk, even after you're feeding, your breast may still be a little bit harder because your body is making more milk now and it's transitioning. So your breast may not be as soft during that transition part, but once your mature milk kicks in and after your breastfeeding sections, if you only breast on one breast, then of course that's the breast that will feel softer and the other breast will feel fuller. If you are one of the moms who decide to offer both breasts in each breastfeeding encounter, then both breasts should experience some form of softness. The baby is content with most feedings. You may have some feedings where the baby may not be content, but usually what I mean by content is that usually we call them closed hands, meaning that the baby is still hungry. Open hands usually mean that they're content. You know, another sign sometimes is that they fall asleep. Now, falling asleep does not always mean that they are content or that they're full. Sometimes they can fall asleep as soon as you put them on the breast because it's a level of comfort to them. Also, a baby falling asleep at the breast does not always mean that the baby is getting enough milk. But at the same time, if you have a good feeding, you latch the baby on, no complications with latching on, the baby fed for 15, 20 minutes. You heard the suck, suck, swallow, you know, all of those things was going well and the baby just falls asleep, then that's a good sign that the baby got enough. If the baby's turning their heads from the breast, that's another sign possibly that the baby have enough, but usually that's when the baby's a little bit older. Pampers, diapers, pee pampers and poop pampers are another sign of the baby's getting enough, because what comes in must come out. If you're not getting anything out, then there's a good chance nothing is coming in. So those are good signs that the baby is getting enough. And weight gain. You know, we want baby to gain, have a consistent weight gain. So as long as the baby's gaining weight, the baby's healthy, you know, there's no concerns or things of that nature, then those are good signs that the baby is getting enough milk. So we talked about the poop and the pee pampers. So breastfeeding babies, bowel movements go through different stages. Excuse me. At the beginning, it looks like this black, tarish, sticky stuff like this right here. It's very sticky, it's tarish looking, it's black, you know, that's how it looked. Then around day 3 or 4, it started looking this greenish color, like they ate greens. And so it started looking like that. And then around day 4 or 5, it started looking like this yellowish, seedy, mustardy poop. Well, the poop should turn yellow, okay? And then it's gonna look more seedy. So you see it's really brighter here, and then it's a little darker here, and it's seedy here. So these are all good signs. So if you're seeing anything like this, then it looks normal, okay? If you're seeing reddish, any blood, anything that just doesn't seem right, call a doctor. Call your doctor, you know, want to be on the safer side than not. But this can be very alarming at first, you know, with breastfeeding parents, you know, because we're not expecting for our baby's poop to look like this, but it's normal. And then it changes, and then the yellow seedy is more consistent until they start eating food, and then it will change again. Okay, signs that you need help. Once again, we talked about if you see any blood or anything in the poop, that's a sign that you may need to call someone. If your baby's eating less than 8 to 12 times a day, if you are feeling pain, again, we do not want you to breastfeed in the name of trying to feed your baby and you are in agony or you are in any pain. The baby never seems satisfied, meaning that the baby is just continually always hungry no matter what. You feed the baby 20 to 30 minutes and the baby just don't seem like he or she is getting enough. It could be an issue with latching. It could be an issue with milk supply. It could be an issue with a few things. So anything of that nature, call. Your breasts are hard, tight, painful. They're cracking. They feel clogged. You may have a clogged milk duct. Anything in the name. As I said, once anything that's painful, call for help. Call, come in, you know, try to get some help because we don't want you in pain. Pain is a sign that something is not right. Your baby has issues with attaching to the breast. You're noticing that your baby is not, well, maybe the baby start attaching on, let's say this is the nipple and this is the baby mouth. Baby may attach on, but then seems to be sliding off, you know, or the baby nibbles onto the breast, you know, anything of that nature. Usually another sign that the baby's not attaching on correctly is pain, you know, or the baby's having an issue with latching on is pain. So if you're noticing any of that, please call. The baby is not gaining weight. That is not, or the baby is losing weight. It's another sign, and you're not receiving any Pampers at all. Now, poop Pampers may change once transitions happen or once they get older. Poop Pampers, the amount changes, you know. But if you're not getting any wet Pampers, if nothing is coming out, the baby's going days, not pooping, baby's going days, we're not giving you any wet diapers, those are alarming signs that something may need to get checked out. So these are just different things to try to keep in your mind. You know, it may be something major, maybe something minor, but if you experience any of these things, we would say call someone and have yourself or the baby examined so we can figure out what the problem may be. First weeks at home. So now we're home, we didn't have the baby. Now what do? Let's nest. So postpartum, most important time is for mom to heal and for her to bond with her baby, for her baby to get to know her and for her to get to know her baby. So we want to try to eat as much fluids as you can, get as much rest as you can. It's important when they say sleep when the baby sleep, please sleep when the baby sleep, because lack of sleep can lead into postpartum depression. And yeah, so we want you to get as much rest as you can. Don't be ashamed to ask for help if you need help, especially if you have other children at home, you know, maybe someone to watch them or make sure that they eat while you nesting with the baby and resting with the baby. Give yourself permission to take care of you and your baby and to focus on you and your baby. Limit your visitors, your phone calls, let people know, hey, you know, I'm going to take this time just to heal and bond, you know, but in the next 3 to 4 weeks or however timeline you want to put on them, you know, we'll be welcoming visitors and things of that nature. But this time right here is set aside for this. This is the time where your spouse, your partner, your support team can come in and help with the cleaning or the cooking or the tending again to the younger children or anything of that nature, because you want to take this time to heal. You know, you just gave birth, your body has to heal. There's a lot of hormonal things going on physically and mentally. So you want to not only be physically healthy, but you want to be mentally healthy. This is the time for you to evaluate where you are at mentally, to see if you feel like you need to ask for help, you know, to identify if you may be experiencing some postpartum depression, or if you're experiencing baby blues, or, you know, or is this just you're exhausted because you haven't had any sleep, you just need a nap, and once you get some nap, you'll be fine. So this is the time where you just need to just focus on you and your baby, you know, because at the end of the day, your baby needs you, and he or she needs a healthy version of you. So as I said, ask for help. Set up your network, ask for help. Don't be ashamed to ask for help. Also, something good to do is talk to your employee about pumping. You know, if you're going back to work, talk about them about times to pump, prepare them that this is what you're doing, saying, hey, you know, I am breastfeeding. These are the things that I'm looking to try to do, you know, so when you go back, a plan will be already put in place, and you won't be trying to put something in place once you get there. You will know when your breaks are, how long you will have, where you will need to be able to pump at, you know, if you have the opportunity to go back to your baby and nurse your baby, you know, whatever. But these are conversations that you should have with your employer. So therefore, when you go back, you will have, you know, a better plan in place. So other than that, these are the references that I have. And now I will open up the floor for questions. If anybody have any questions or concerns, this is the time that we can discuss those.